or everybody in the waiting room, the lobby, waiting to be seen. Everybody is sick here. We're all mixed together. And nowadays, I think most clinics have like a divided section where some of them are they're in the sick lobby. We have symptoms, and then the other ones are waiting on the sick lobby. So healthcare associated infections can happen anywhere in long-term care facilities, also known as nursing homes, hospitals, doctors' clinics, anywhere, as long as it's you're in an area where healthcare services are delivered. It's 1.7 million healthcare associated infections, 99,000 associated deaths each year. These are a lot of people that are losing their life unnecessarily, primarily because they're getting these infections from us, the healthcare providers, right? Nurses, doctors, CNAs, phlebotomists, all of us are guilty of this. So we're the main ones that are carrying things around to other people, and it's not fair for them. All right. So please make sure that you follow strict infection control practices. All right. Moving on. All right. So there's other kinds of bacteria that we are more concerned about because
Damn it.
these bacteria are not easily taken care of. Usually at home, you might, develop an infection, maybe a respiratory infection. You take an antibiotic for a few days and it'll go away. But there's some bacteria that you need to be conscious about that do not go away, and we take extra precautions for
MRSA.
that. Okay, so bacteria such
Phylloxera.
as MRSA or MRSA, we call
Pterococcus.
it a MRSA. Now, this is what they call methicillin resistant Staph
Coli.
aureus. We have Staph aureus in our skin. It's part of a normal organism in
Fuck
our
them
skin. However, when people take antibiotics over and over repeatedly for any little thing, a cold or something like that,
Background.
they take antibiotics.
Focusing on
These bacteria will eventually
is the
grow
text.
resistant. All right. So we see this a lot in the older
Text.
patients. Why? Because they go to
This
the
is a
doctor
book.
very often.
Cost
Doctors
upwards of
prescribe,
a couple
antibiotics all the time
$100,
because people
like
demand them,
$20 in the
right?
black market.
And so they eventually develop this kind of infections, this kind of bacteria.
I think
And
it's made
again, they spread them to
after
a
the year
nurse or a
2020,
healthcare provider. And next thing you know, another patient
2021
has it
publication.
because it's spread because of poor infection control
This.
practices,
Oh,
and it becomes very difficult to get rid of them. Another one that's also very common, and this is not a resistant strain, but very common, is called C. diff, Clostridium difficile. All right, this infection or this bacteria organism lives inside our body. Okay, it lives in our small intestine. Clostridium difficile uh, is
yeah.
um, is part of our
I
natural
want to do
flora.
something
Okay,
different.
it helps our body stay healthy, but you cannot have too many of it in your intestines because it will create diarrhea, and we're talking about major
Gotta eat
diarrhea
that
that
probiotic
can happen
yogurt.
for over a month. So you definitely don't want to contract C. diff. All right, a lot of these patients have developed C. diff again from overtaking too many antibiotics. So think about it. If you
Other
have
page.
an infection, let's say you get a respiratory infection and you go to Mexico to go get an antibiotic. Okay, when you're taking that antibiotic, guys, it's not just killing, right, specific or the organism that you're sick with, but it also wipes out a lot of your natural, normal, what we call intestinal flora or the bacteria that live there. Okay, so we all live there, have bacteria. Okay, uh, don't think you don't have it. We all have them. They're there. Okay, that's why anything that creates bad odors, it's produced by bacteria, right? So when you take an
Moving on.
antibiotic, this antibiotic kills a lot of your
Care
natural good
associated
flora
infection.
or intestinal bacteria. And what happens? The other bacteria overpopulates in your intestine, giving you a problem like diarrhea. Okay, so it's really important that you don't self-medicate at all. You should actually go see a physician to prescribe medications for your problem. Enterococcus. Entero means your intestine,
Intestines.
and the
Gains.
abbreviation
But
coccus,
at the same time,
COCCUS, refers to the shape of the bacteria. In this case, we have
believe.
a round shaped bacteria. Okay, so that is also a common infection that is contracted mainly in the urinary system. Why? Because of poor hygiene. People are not following good hygiene, hand hygiene practices. The elderly people sometimes when they have fecal incontinence, urinary incontinence, they get this infection very often. Okay, so MRSA is one of the multi-drug resistant bacteria. E. coli again is another bacteria that lives in our intestine, Enterococcus coli. You have to be careful with it because it is contagious. Okay, most of these organisms that I'm talking about are contagious. We call them direct contact, right? It means that You can only contract it if you have direct contact with that person, right? So you have to be careful. You have to wear your personal protective equipment. In this case, you would obviously need gloves. You would obviously need a gown to make sure that you don't contract that bacteria into your uniform and carry it on to the next person. So again, be careful with every patient that you see. If you see a sign on the door that is signaling you to go to the nurse station, or it's telling you to wear certain PPE, please follow the recommendations. If you don't follow them, you ask. Okay, if you don't know, you ask. All right, and move on. Okay, so one very important thing that we need to know, okay, that we need to understand is how is that organism going from one person to the next. Okay, I just spoke about some organisms that are passed on directly, right? So you have to understand the chain of infection. Okay, what is the agent that is making you sick? Okay, let's say for example we have COVID-19. All right, COVID-19 as of right now, we believe it's passed on through the droplet, like talking, spitting, coughing, sneezing. That's what we believe it's spreading. Okay, and there was a few times some people were saying that it was airborne, which is much more dangerous, okay, much more difficult to manage. But we have to identify the agent and how is it making it from one person to the other. Okay, so in the chain of infection, five we need five elements. Number one is the agent, the infectious agent, the pathogen, the one that is making you sick. Okay, what is it? So the CDC will go around and obviously investigate, grab samples of, from the nose, from the mouth, all this kind of stuff, right? And they find out, oh, they name it, they give it a name. Okay, so now we know it's COVID-19. All right, where was it living? Well, as far as we know, it was passed on through a supposedly some of those wet markets, they call them, where they sell live animals, and it was passed on from one animal to a human, and then so on. That's what we were told in the beginning. But every organism needs a reservoir. Okay, these organisms cannot live without a reservoir. A reservoir could be an animal. Why? Because they're alive. They have nutrients in them. They have moisture. Okay, they have a good environment. So that's all they need. Humans are the perfect reservoir. Okay, but you could also have other reservoirs like uh, buckets with water. Okay, or moisture. Let's say in the restroom, there's water always in the faucets. Bacteria love that. Okay, so moisture, nutrients, they can a perfect environment for these agents, either bacteria, fungi, viruses, whatever it is. So the reservoir is the source of the agent, okay, the bacteria. And say I'm carrying around COVID, okay. I don't know I have it, but I can carry around and then pass it along, and nobody knows, and I don't know. So this agent will live in me until it makes me sick and starts to give me symptoms. Then I'm going to realize, wait a minute, something's wrong with me, and I may test positive for COVID-19. Thank goodness I haven't, but it could happen to anybody, at any point, even though, thank goodness, we're kind of, turning the corner around, hopefully, with this virus. We still have to be very cautious. Okay, people are still traveling. They're traveling now more, so bacteria travels with them, and it goes to another area, and that's just the way bacteria travel. Okay, so we have to understand um, the agent, the reservoir, and then a pathway. How does this organism make it out of the body? How does it travel? Well, we talked about the bacteria that travel through direct contact, right? I touched this person, I got in contact, I got it in my hands, I didn't wash my hands, I go to the next patient and I pass it on to them, I shake somebody's hand, I touch my face, etc. Okay, so how does this bacteria or agent travel? You have to understand how it travels. That way you can better control it. Okay, so we have to have an exit pathway. In this case, with COVID-19, we know that our nose, our mouth are the main exit pathways. We sneeze it out, cough it out, speak it out, we talk, saliva comes out, it lands on the surface, on the table, somebody comes around, puts their hand on the table, and so on. Okay, the cycle repeats itself very quickly. So the means of transmission, again, there's three means of transmission that we'll talk about. Very important that you understand, all right? Airborne. Airborne means suspended in the air, all right? If a person jumps off a plane into the air with a parachute, obviously, right? They're airborne. They are suspended in the air for a certain amount of time. Eventually, they make it to the ground safely. bacteria do the same thing, right? When somebody has an airborne infection, you will cough it out, sneeze it out, speak it out, and it will stay suspended in the air. Why? Because that virus or bacteria is so small. It's like sometimes when you see a ray of sunshine going through your window, and in that ray of that light, you see like dust. It looks like dust hanging around. Well, there's also a lot of bacteria hanging around and viruses that hang around in the air. These are called airborne, right? And it doesn't take a lot for you to walk in there and breathe it in. Now it's in you. Okay. So again, airborne are very difficult to manage. We require N95 masks to control this. Okay. That's why I always wondered when they were saying, well, COVID-19 is a droplet. Well, in this case, we just need a cloth mask, right? But no, in the facilities, they make us wear N95s, which are special masks. They have a special filter to be able to make sure that that organism doesn't make it, into me and then into others, and I'm going to carry it around. So N95 masks are needed for airborne. Okay, one of the most common ones is tuberculosis. Tuberculosis is a long time bacteria that can live in your body for many, many years. Okay, can stay there if you're exposed to it, and eventually when your immune system goes down, it'll make you sick. All right, so usually it happens in the later stages in life. People that contract tuberculosis are usually come from countries where they are not screened for tuberculosis. Here we are screened all the time. As a matter of fact, we are screened every year. All right, so again, remember, we are have to follow any infection control practices as it relates to airborne. Okay, so airborne precautions requires, again, your N95 mask and your gloves. Okay, you don't necessarily need a gown. Okay, but some people may require you to wear a gown, especially right now with this pandemic. People are asking you that you wear a gown if you're going to go into a patient that has COVID-19. Okay, so contact precautions like the ones we talked about earlier: C. diff, MRSA, E. coli. All right, all of these require contact precautions. Okay, you can only contract it by direct contact, like touching someone that has it. Okay, or somebody has a an oral bacteria, and you kiss that person or whatever, you may come in contact with it. If you touch contaminated objects, like in the hospitals, if a patient has a let's say it has E. coli, and they touch themselves down there, and then they touch the bed rails, they touch everything else, and you come into the room and you don't know what they have, and you don't know that they've been touching everything else, well, you might indirectly contract that bacteria. So again, this is why it's very important that we use gloves all the time when you're coming into contact with the elderly people. All right, or any patient rather. You don't need to be elderly. Any patient that has is potentially infectious. Okay, so you treat everybody as potentially infectious. Doesn't matter if they're young or old, right? Now, we have to have an entry pathway. The entry pathway is usually the same as the exit pathway. If you sneeze and cough out any bacteria or viruses, it goes into to your body, or you cough it out. I'm sorry, you sneeze it or cough it out. Usually, it's going to go in the same way, right? Inhale it in, okay, and you're going to contract that virus or infection. So the entry pathway could be any orifice in your body. It could be your eyes, okay. You might get an infection in your eyes, your nose, your mouth, your genitals are also entry pathways. An open wound could also be considered an open airway. So again, make sure you understand the chain of infection. Okay, so we need an agent, right, or a pathogen. We need a mode of transportation. Okay, how does it make it from one place to another? Okay, we need an exit. How does a bacteria make it out of the body? Okay, how does it travel? Okay, with mode of transportation. How does it make it into your body? And lastly, a susceptible host. Bacteria cannot make just anybody sick. If you're healthy, you're young, okay, you're well rested, you are not susceptible. Okay, as you've heard with COVID-19, is everybody susceptible? No. For some reason, kids were not as susceptible as older people. Right? The immune system of older people is very weak usually. Okay, so they were very highly susceptible to COVID-19. So someone with a decreased ability to resist infections, such as a person with HIV, a person that is on chemotherapy, radiation therapy, etc., they are susceptible hosts. All right, and of course, kids are very susceptible to a lot of other infections, except this one. COVID-19, obviously, they were not very susceptible. Otherwise, we would have been real bad pandemic. Okay, so age, health, your immune status, all that plays a role in your immune response. Okay, the best way to stay immune is to eat well, get rest, okay, and stay healthy as much as you can. So here are again are the elements of a infection control. Your agent, all right, a bacteria, fungus, or whatever. A reservoir, where does it live? Animals, humans. A bucket, okay. An exit pathway, how did it make it out? Through your blood, to saliva, mucus, coughing. All this is an exit pathway through your nose, through your mouth, through your genitals. And immune transmission, how does it travel from one person in one place to another? Okay, did it travel through the air? Was it suspended in the air? Did somebody cough it, sneeze it like a droplet? Did you get it through a mosquito? Do mosquitoes carry it around? Okay, so there's a lot of means of transportation. So that's why it's important that we understand how they travel, so that we can make sure that we can take control of this bacteria. How does it make it into our body? Okay, is the insect going to have to bite us? Are we going to inhale it? Okay, what's going to happen? Is it comes in through an open wound? And of course, you need a susceptible host. Okay, that would be us, someone with a weak immune system. So your job, our job, is to make sure that we break that chain of infection at some point. When we understand everything about this bacteria, like these links, then we can go ahead and start trying to stop or control the spread of infection. Okay. So in COVID-19, we finally understood that it's droplet, supposed to be droplet. Okay. And we understood that by wearing a cloth covering in public, an N95 in the facilities, wearing gloves, and sometimes even PPE, we were able to control the spread of infection from person to person. Okay. Of course, hand hygiene, washing your hands, is the most important way. Okay, there is no way around it. Hand hygiene is by far the best way to control the spread of any infection. All right, nutrition, rest, getting immunized. The flu shots are out there now. If you are interested in getting a vaccine, control any insects or rodents, whatever the cause or the source of transmission for any agent. You need to make sure that you control that. Follow all isolation procedures. Okay, so when a person is on isolation precautions, you're going to see a sign on the door that it's going to tell you what kind of PPE you're going to wear. It's going to say, it may say contact, it may say airborne, it may say droplet. All right, so make sure you understand what those are. All right, and before I go on, there's standard precautions, or your basic precautions. Okay, what does it mean to to take standard precautions? All it means is you're going to wash your hands and wear your gloves with every single patient. It doesn't matter who it is, what age, where they are. You're going to take your standard precautions with every single one, right? Now, once a person develops or contracts an infection like the ones we just talked about, okay, a droplet, airborne contact, then you're going to take additional measures. And we call those transmission-based precautions. All right. So you say, well, this person doesn't have anything. What am I going to do? Well, I'm just going to wear gloves and wash my hands every time I go into the room. The same person now contracts an infection like COVID-19. What am I going to wear? Okay, well, I'm going to wear gloves, yes. The mask, the N95, and of course now maybe a gown. Okay, whatever isolation precautions they ask you to wear, you need to follow them. All right. If not, you're increasing the risk of you contracting something, or somebody, another patient, more important. Infection control programs are there to protect patients, employees, visitors, and others. Again, we have to keep it very much under control to break the chain of infection. If we don't break that chain, then the infection just perpetuates. It keeps on going and on forever until we actually take measures to stop it. Our job is to monitor and collect data on all infections occurring in an institution. Very important. Once one person contracts an infection, right? And let's say, for example, nursing home, if one of the residents is diagnosed with resistant type of bacteria, it has to be reported to the state. We have to put them on isolation precautions and everything else in between. Okay, we have to do a lot of other steps and documentation and special care for that person, so that we don't spread it to the following residents. Remember, their immune system is low. So, an infection control institutes special precautions in event of outbreaks. Again, the components of a program should include employee screening. Right now with COVID-19, we're all getting screened twice a week, but thank goodness now it's down to once a week. Okay, we evaluate and treat everybody. If you were tested positive for COVID-19, you were evaluated right away. You were put on quarantine for 14 days, given treatment, if any, if you had any symptoms, okay, and you were being monitored. Yeah, I know it. There was a time when there was these people that were called the tracking tracers. They were calling people up and finding out how they were doing and who they had come in contact with and so on. It was getting pretty out of hand, but thank goodness that it's finally, I think, under control. The numbers are decreasing week by week. Again, so the most important hygiene practices are hand hygiene. Okay, use your antiseptics, your gels, your foams, of course, hand washing. Your wear your PPE, your gloves, gown, mask, whatever. Face shields. Oh, we've been using face shields already for a long time. And of course, your respirators or N95 masks. All right, make sure you know what they are and when you have to wear them. You're gonna see this on the test. Okay, very important that you know how to put on and take off your gloves. Okay, so to remove your gloves, guys, always make sure you have your gloves on. Okay, let's say your dominant hand, you're gonna pinch the glove from the middle of your opposite hand, pinch it, and slowly pull it out, peel it out of your hand, and roll it into a ball. Right, now you have a gloved hand with a dirty glove. With your ungloved hand, you're gonna come under the glove and peel that glove over the dirty glove that you just took off. Okay, so we say glove to glove and then skin to skin. Okay, that is one of the ways that you want to prevent your clean hand coming into contact with a dirty glove. Okay, so make sure you know how to do that. Okay, the respirator, there's an example of an N95. You can make sure that you know when to use it. You don't use them all the time, only when it's necessary, when a person has a droplet or a airborne infection. Okay, you also have to know this. Make a very important note, guys. You have to know how to put on your PPE. All right, and here's the order right there. You've seen it. To put it on, you put your gown, your mask, and your gloves. Okay, assuming this is the only PPE that you're going to wear. Okay, gown, mask, and gloves. So first you put on your glove. You open your gown. Okay, I'm sorry, your gown. You're gonna open it without the gown touching the floor. All right, you're gonna put it on. You're going to tie it down around your waist and around your neck. Okay. After that, you're going to put on your mask and finally your gloves. Okay. Your gloves should go over your gown. I believe it is a tested item in the nurse assistant exam. So if you haven't practiced that, make sure you know how to do that. Now, it might be a little different in the CNA test, but make sure you follow those steps for that course. Okay. Now you're gonna have to take off the PPE once you're done taking care of the patient. All right. How do you take it off? First, gloves. How we just said, glove to glove, skin to skin. Throw that away. Then untie your gown. Untie your gown. You're gonna take it off on the inside. So we're gonna put your clean hand in the inside of the gown because the inside is clean, the outside is contaminated. And you're gonna peel it off. Okay, peel it off without making contact with the outside. You're gonna roll it up into a little ball, get rid of it, okay? And then finally your mask, okay? So you have to know this order, guys. Put it on and to take it off. You are gonna see it in the exam. Very, very important. Isolation procedures, again, it's very important that you understand what kind of isolation methods or practices you're gonna do with certain patients. You're not gonna do it with everybody, just with some, okay? Scrubs or other pants that are touch the floor can easily pick up infectious material. So according to CLSI laboratory safety guidelines, pants worn by laboratory personnel should be 1 to 1.5 inches off the floor to prevent contamination. Okay, obviously, you don't want your clothes to be dragging on the dirty floor. You'll be carrying that around forever. Some of the examples of isolation procedures include protective or reverse isolation. We use this when a person has a weak immune system, someone with HIV, someone with cancer on chemotherapy, radiation therapy, their immune system goes really, really low. And if you know that you have a cold or you have something that you might spread to them, number one, avoid going to that room. Number two, if you are going to go over there, make sure that you wear a mask or whatever equipment that you need. Do not expose them unnecessarily. Okay, this is what we call reverse or protective isolation. Traditional isolation systems, again, they're category specific, disease specific, right? It could be contact, droplet, or airborne. Okay, so you're gonna have to follow those specific guidelines. Standard precautions are also called universal, and I said what those are, right? Always washing your hands, always wearing your gloves, right? Body substance isolation goes beyond universal precautions. For example, somebody that has like um, a urinary infection, okay, like MRSA or E. coli in the urine, you have to take extra precautions for that. Standard precautions, I just explained what those are. What it really means is that you treat every body fluid as contagious. If somebody's incontinent of urine, okay, does it mean they have an infection? No, but it doesn't mean they don't have it either. So you have to make sure that you take your precautions, right? If a resident, you're going to help a person, a resident with a personal care, especially perineal care, make sure you wear gloves. Okay, you don't know what they have, what they're carrying around, and if you go around, in their environment without gloves, you don't know what they've been touching. So you have to make sure that you wear your gloves. Okay. Hold on one second, guys. Let me get my charger. Is everybody there? Everybody doing all right?
Yes.
Hello? Anybody there?
Yes, I'm here.
Yes.
Hello? Are y'all there?
Yes.
So we
Yes.
continue
Yes.
conversation in biosafety. You've seen this symbol before, right? You've seen it in the sharps containers. You're going to see it in other plastic bags. This is a biohazard or biosafety symbol that you need to be familiar with. So if you ever are going to deal with any kind of sharps or any body fluids, you're going to see this symbol. If you're going to dispose of any needles that, of course, have blood, which is a body fluid, they are considered contagious, possibly contagious. So they're disposed of in a container that has a symbol like this. Okay. Biohazard exposure routes, of course, everything that comes out of the body in any shape, way, or form is considered a biohazard. Okay, either be airborne, ingested, wound drainage, anything that comes out of the body through the any orifice considered a biohazard. Now, you have to be familiar with this kind of hazards, which include bloodborne pathogens. Bloodborne pathogens, all it means is that the viruses or bacteria came directly from the blood. All right. So your best defense, or one of the most common ones, is hepatitis B. Hepatitis B virus attacks the liver, and gradually, slowly, it kills the liver. All right, causing a liver cirrhosis in the long run over many years. Hepatitis D is not very common, but hepatitis B is. It's most commonly transmitted through direct contact. If you have contact with somebody that has hepatitis B and you perform a venipuncture on them and then you puncture yourself accidentally with that needle, you might contract hepatitis B. However, good for us, there is a vaccine that can help us minimize the risk of us contracting that. All right. So make sure that you obtain the hepatitis B vaccine. As a matter of fact, you guys have already had it when you were a child, when you were an infant, then a child, and then a up to, I believe the last dose you got was around 14 years old. You were given another booster vaccine for hepatitis B, right? But as we get older, our body loses some of that immunity. So it is important that you obtain what they call a hepatitis B titer. A titer is like a level of immunity. That what it is they check your blood to see if you still have immunity to hepatitis B. And if you don't, you can get a series of booster shots. Okay, so you have to know this. You have to make sure that number one, you obtain hepatitis B. Okay, your employer by law is required to offer it to you, and you're supposed to accept it if you want. Okay, a lot of people will discourage you from taking it because it's not expensive to them, but do not waive it or refuse it. Go ahead and take it if you want, and that way you are protected at least from hepatitis B in case you ever get exposed to it. It is common, so again, you're gonna be working directly with blood all the time. The best thing would be to consider taking it. All right. Oh, it is present in the blood and other body fluids. Can survive up to a week in a surface. Okay, transmitted via needle sticks and sexual contact. So again, make sure that you very careful with needles. Okay, the symptoms from the onset when you contract hepatitis B are like a flu, just like any other infection. Down pain, nausea, you lose your appetite, and sometimes people become a little bit yellow. So you see some of this what we call jaundice on their skin, right? But it's not, thank goodness, not very common that we see hepatitis B spread nowadays. Another one is hepatitis C. It's from the same family. It's B, C, D. All right, and there's an alphabet of hepatitis, but the most common ones are B and C. Okay, this is again someone that has hepatitis B. He can give it to you via direct blood contact. Okay, and the symptoms are very similar to hepatitis B. Now, there is no cure for hepatitis B. There is no vaccine for hepatitis C, only for hepatitis B. All right. So, what does the government say? What do they do to help us or protect the employees? Okay. OSHA is the Occupational Safety and Health Administration. They oversee they oversee facilities, companies to make sure that they are providing for their employees the safest environment. Just like contractors, right? That and they're in construction business, they have to provide your employees, a hard hat, maybe boots are required, steel toe boots, and so on. In healthcare, they also require healthcare facilities like hospitals and nursing homes to be able to provide for us what we need to be safe in our job. For example, gloves. We cannot work without gloves. Okay, it's very important. So OSHA mandates that they provide gloves. That's one of the requirements. Okay, if a person develops a specific type of infection, well, that facility has to provide for us all the equipment necessary. Okay, so OSHA had developed a standard for bloodborne pathogens. It is an enforceable law, meaning that if the company violates it, they will be fined for every incident. Okay, the law is intended to reduce or eliminate occupational exposure to bloodborne pathogens. So, what else do we need besides gloves? In phlebotomy, we also need those engineering controls. Okay, those safety features that are on the needles, on those tube holders, uh, the sharps containers can also be considered an engineering control, okay, because they have those little one-way valves that open only in one direction. So OSHA demands that, okay. They demand that the employers offers, or not offers, but provide PPE for us, and they give us the training. And if we ever get exposed to something, they have to make sure that they have a plan, okay, so that we can get medical treatment and be monitored after that. Okay, so it's not just about the equipment, but also about the aftercare in case we do get exposed, and because some people will get exposed at some point. So the availability of the vaccine for hepatitis B, again, it's a requirement from OSHA. So don't refuse that vaccine if you ever get it offered. Make sure you get it. Okay, it's a series of 3 vaccines, and we'll go into the requirements in just a bit. They also came up with something they call the Needle um, Safety and Prevention Act. Okay, it's very, very important that the government help keep the employees safe. So they came up with this idea of a Needle Safety Prevention Act. This act imposed additional requirements on healthcare employers concerning sharps procedures. Okay, in order to keep it, keep those needle sticks at a very low level. So what happens if you get stuck with a needle? Well, the facility again has to have an exposure control plan. Okay, it must be in writing. Okay, it must be in writing. You can't just say, "Oh, well, you got exposed. Well, you know what? We'll go to the doctor." And they have to have all these things already written, ready to be used once somebody gets exposed. It has to be reviewed and updated at least annually by the facility, meaning that if someone is exposed, okay, they have to go back and see, well, how many exposures did we get for 1 year? 0, fantastic. One, two, three. So this gives them an opportunity to review their policies. All right, maybe their policies are not very effective. So again, this is why they have to be reviewed once a year. Non-managerial employees, which means us, the actual workers, the ones that are out there getting exposed to these bloodborne pathogens, have to participate in this development of a plan. Okay, why? Because we're the ones that are getting exposed. We know how we're getting exposed, what's going on. All right, so they have, by law, they have to involve us in developing the plan. Okay, identifying, reviewing, and selection of the plan. Bloodborne pathogen exposure routes. We get exposed to bloodborne pathogens in many ways through the skin, okay, like getting stuck with a needle, blood, something that gets splashed in your eyes or nose, the mouth, right? Blood or other body fluid contacts, cut scratches. If your skin is open for some reason and you come in contact with someone, you have a very high risk of contracting an infection. So that's why we have to wear gloves. A human bites. One of the residents gets upset, a patient gets upset, and bites you, you might contract something like that because hepatitis B and C are in the saliva, could be in the saliva because if they have blood in their mouth. Exposure incident report has to be completed after you are exposed. Okay, if you have a needle stick, you must report it, guys, right away. Okay, but there are certain steps you got to follow once you get exposed. The needle stick or other sharp object injury, if you get exposed, just if it's a big piece of glass, of course you have to remove it. Okay, number one thing you have to do if you get exposed is to wash the site with soap and water for at least 30 seconds. Remember this, highlight it, write it down, tattoo it on your arm, but do something. Wash with soap and water for at least 30 seconds when you get stuck with a needle, okay, or you're exposed to um, a sharp object that has body fluids like blood. All right. Mucous membrane exposure. Mucous membranes are your eyes, your nose, your mouth, okay, genitals. Flush the sides like your eyes. Okay, something splashes into your eyes. Flush it with water. Could be regular water. There's usually going to be an eye wash station. You have to know where that eye wash station is. Okay, for at least 10 minutes or 10 minutes. Especially your eyes, they absorb bacteria very, very quickly. Okay, so you have to make sure that you rinse that area for at least 10 minutes. Use the eye wash station if available, okay? Or have somebody pour water over your eyes. Remove any contact lenses if you have them on them and disinfect them. Report the incident to the immediate supervisor after you giving yourself some first aid, okay? Then you report it right away. Report directly to provider for evaluation, treatment, and counseling, all right? If you're exposed to someone with HIV, you gotta rinse off first for at least 30 seconds, right, with soap and water, and then report it. and then they're going to send you for medical treatment to get evaluated. Okay, they're going to check to see, make sure you didn't contract anything. Very important that you follow those steps. Okay, first aid is first, always for yourself. Okay, forget about going to the ER. Go wash your the area first. Of course, we have to work in a clean environment. Okay, we have to make sure that we disinfect surfaces. Remember the difference between antiseptics and disinfectants. Here, we're going to talk about disinfectants. If you're going to be cleaning an area that is infected with body fluids, let's say you spilled blood or urine, whatever it is, you have to clean up with a 1 to 10 solution of sodium hypochlorite. Remember, sodium hypochlorite is the word for bleach, all right? So that is what we use to clean up any body fluid spilled, all right? Now, if you're going to just clean the areas, okay, the desk, the counters, things like that, it's a 1 to 100 solution, okay? It says 1 milliliter of bleach to 100 milliliters of water, okay? If you're gonna make 1 liter, then obviously it's 10 times that, right? 100 milliliters of bleach and 1,000 milliliters of water. Right, so it's a 1 to 100, and 1 to 10 is for uh, body fluid cleanup. Okay, clean up body fluid spills with EPA-approved chemicals. Remember, these are for disinfectant, not for human use. Yeah, please, you have to wear gloves because that might be irritable to your skin. And absorbent material. When you're gonna clean up a spill, guys, you have to remember that you have to contain the spill. Okay, and to be able to contain it, usually they pour things on it, something like that can absorb. It could be something like, it's not kit litter, but it looks like kit litter. Okay, that they pour it over the spill. It contains it. Okay, and you spray that disinfectant, it kills it, and then it's picked up. Obviously, you have to wear your industry gloves. Okay, you can't use this regular gloves. Okay, we're going to dispose biohazards. Okay, everything that is non-reusable, they're single use, like your needles and all that kind of stuff, okay, has to go in the biohazard sharps container. Again, only sharps. Do not dispose of gauzes and things like that in the sharps container. They don't go there, okay? That is only for sharps. One more thing, I'm gonna take a little break, all right? So we talk about electrical safety. This is one of the questions that I've heard been in the test. What do you do when somebody gets electrocuted, okay? Shut off the source of electricity first. Okay, if you can, disconnect the appliance, the object, whatever it is, disconnect it. Okay, use non-conducting item to remove the source of electricity from the victim. If possible, something that is non-conducting like plastic or wood can be used. Okay, call for medical assistance. So when someone's electrocuted, call for medical assistance. If the patient does not have a pulse and they're not breathing, you're gonna have to start CPR, okay, and keep them warm. Remember these steps, guys. This is first aid. You're gonna help, one of your fellow coworkers that got electrocuted. This is what you do. You have to make sure that you follow the steps, right? That you know them, because there might be a question in the test that will ask you, what are one of the things that you should do when rendering first aid somebody that got electrocuted? And you might think, oh well, I should remove, shut off the source of electricity, but that's not one of your answers. So you're like, oh my God, what do I do now? So you have to know all these measures, okay, in that specific order. You have to know them so that you can be able to respond to that medical emergency if necessary. Okay, so I'm gonna pause for just a bit, okay, and we're gonna resume. All right. Fire safety. Everybody needs to know about fire safety. Everybody in the entire facility has to know about fire safety. So if you are working in a facility, hospital, nursing home, whatever it is, you have to make sure that you know the acronyms about RACE and about PASS. So you should know that what procedures to follow in case there is a fire, where are the new exits, where are the fire extinguishers. You should know how to make sure that all the hallways are always clear on one side of the hallway. Who do you remove first, who's last, and so on. So again, this is part of your job, so you need to make sure that you are aware of that. Know where the exits are, the evacuation routes, and so on. Components needed for fire to occur. Obviously, you need fuel, heat, and oxygen to start a fire. But most importantly, you have to know how to control a fire. Okay, very important. Here's the fire tetrahedron. Obviously, you need the oxygen is what makes that fire burn faster and sometimes stronger. Fuel, whatever it is that makes that fire burn longer. We need to also control that. There's different kinds of fires that you should expect. The most common ones are usually Class B fires. Class A fires are usually wood and paper. B fires are more flammable liquids like gasoline, vapors. All right. Class C fires are electrical. For this reason, we usually have in the facilities fire extinguishers that can deal with A, B, C fires, types A, B, and C. And you should know how to use that fire extinguisher, including using the acronym PASS. All right. You don't have to worry too much about Class B or Class K fires since there's more like for kitchen and other environments. Radiation safety, however, let me go back and just rephrase. So RACE is Rescue Alarm Continuum Extinguish, which is the order you need to react to patient safety.
Sí, mi amor.
Remove,
Se quedó en la
activate
camionetilla ahí.
911, contain fire if possible,
Ya
and
haciendo un dos.
evacuate the facility. All right. And to be able to use the fire extinguishers, make sure that you remember that you have to pull the little pin that is in the extinguisher, aim at the base of the fire, squeeze the handle on the extinguisher, and then make a sweeping motion to turn off the fire. We move on to radiation safety. The principles of radiation exposure. If you are a young female that is of childbearing age and
El
you
cuarto,
think
¿cuál
you might
cuarto?
have a child or be pregnant, then you should not go into
Sí,
a
el
room that has
aire.
radiation, all right? But if you're not,
Por
you're
ahí
pretty
viene el
sure that
chiquito.
you're not pregnant,
Porque igual
you
a
should make sure that you keep your distance from the person. Usually there's going to be a shield, a lead shield in front of you between you and the patient. There's going to be a lead vest that you also have to wear. And there's a small device that you put on yourself so that it measures the amount of radiation that you're exposed to, and we have to keep a record of that. So distance shielding and time is what you need to be make sure that you're aware of as far as safety for yourself. The radiation that patients have are usually devices that are inserted into the vaginal orifice, more commonly in females, and that's how they receive radiation therapy for problems like ovarian cancer, uterine cancer, cervical cancer, and so on. Chemical safety. General rules, always wear your PPE. Of course, if you're going to be dealing with chemicals, clean up any chemical spills properly. There are chemical spill kits. All right, so these kits have specific items that are in there so that you can be able to contain, for example, let's say a chemical is spilled in the laboratory. You need to know how to react to that. You make sure that you get a spill kit. Do not try and pick up any chemicals wearing simple gloves. You're going to need the specific items that are in the kit so that you don't come in contact with chemicals that might be hazardous to your health or burn your skin or things like that. So remember that you first get the spill kit. OSHA hazard communication, HAZCOM labeling requirements. Everything that we come across as far as chemicals has to have a label in it, how dangerous it is for health. Is it dangerous or is it poisonous? Is it toxic, flammable, combustible? Does it can go up in fire? Okay, so all these items are required by OSHA to be on the products that we're using. Okay, so that we can make sure that we are more cautious. Okay, in case we don't want to cause a fire or an explosion that might cause injury to us or to others. You have to know where the safety data sheet. The safety data sheet is a binder. It's more. It sounds like it's just one sheet, but it's actually a binder with all the information about chemicals that are used in your facility, more specifically in your lab area. All right, so you have to know where the safety data sheets are. You don't have to know what's in them so much, but where the binder is located at. And they're usually going to be labeled with bright colored, okay, large text so that you can see that and you have access to it. You have to be accessible to you. Chemical safety, Department of Transportation labeling systems. Again, this is more for companies that uh, carry various chemicals that are either flammable or they're hazardous to our health. They have to have all these different numbers on them and symbols so that we understand that we have to be cautious. Next time you drive in the road and you see a one of those big pipe looking trucks, and they usually carry gasoline for cars. They go to the gasoline stations. Look at those symbols and you're going to see, is it flammable? What is that four number? What does it mean? The color on the square rectangle. Okay, so these are all numbers that have a meaning, but as soon as we see a fire, we know that we should probably stay our distance. This is another diagram that the National Fire Protection Association came up with. Okay, now you don't have to be too much knowledgeable in this for exam purposes, but just for your own knowledge. Okay, the blue means health, or signal blue, it means it could be dangerous to your health. The red colored means obviously flammable, and three usually has to do with radioactivity. If anything is radioactive, if you see yellow, you have to be careful. Okay, especially if you might think you're pregnant. All right, what do you do if you are ever exposed to a chemical? Right, if you're splashed or you come in contact with a chemical, remember that first aid is always first for you. Okay, know where these showers are. These safety showers, they're located usually on every floor. Okay, so you have to know where they are. The eye wash stations, same thing. In case, remember, you are going to wash your eyes for a no less than 10 minutes, okay, with regular water or stir water, whatever's available for you, okay? And if you come exposed to a chemical, it's a little bit longer. Flush the affected area for at least 15 minutes, okay? So any punctures or needle sticks, at least 30 seconds, right, with soap and water. Any contact splashes to the eyes, at least 10 minutes with water, and chemicals, at least 15 minutes in the showers, okay, those safety showers. Of course, after that, you report it to your supervisor, and they'll send you to get medical evaluation. It's an example of a spill cleanup kit, all right? The gloves are not your regular gloves. They're usually more industrial um, type gloves. They're thicker, okay? They can be exposed to different chemicals without, causing injury to you. Safety goggles. Okay, there's that super absorbent material that you pour on the spill so it can pick up the chemicals, and of course the little broom and the little shovel to pick up all the equipment. First aid is very important, and you'll see some of these questions on the national exam. If someone is having a hemorrhage, hemorrhage is a serious bleeding. Okay, it's more than just a small blood. You have to remember to apply direct pressure to the site. Okay, always apply direct pressure to the site. Either you tell the person to apply direct pressure on themselves while you put on your gloves. All right, hand them a paper towel, a piece of cloth, whatever it is. Make sure they apply direct pressure until it stops while you put on your gloves. After that, once the bleeding or the hemorrhage has slowed down or stopped, you're going to apply a bandage, okay? With enough pressure to contain the bleeding, but not too much pressure where you're going to stop circulation to the distal area, okay? We don't use tourniquets very often anymore. The reason being that a lot of people would forget to remove the tourniquets, so they're not used very much. So as a last resort, let's say somebody actually loses their leg and is bleeding to death, then a tourniquet would be okay. So the original compress should never be removed. Once you apply a gauze on somebody that is bleeding, leave it on there. Do not remove it. You just add more gauzes and more gauzes, okay? Because if you remove that original gauze, you're bringing up that platelet plug, that little um, plug that is stopping the bleeding. You're going to bring it along with you, and the bleeding continues. So never remove the original gauze. Just put more gauzes on it if they become saturated, all right? But front pressure should be sufficient to contain the bleeding. Shock. What is shock? It's not electric shock. Okay, shock is when your body goes into shutdown mode, pretty much. If your body is starting to shut down because of either infection, a severe infection in your blood, or there is a lack of blood in your system, it will gradually slow down and shut down. Okay, the person may become in unconscious. It doesn't mean that they're dead, right? It means that their body's trying to preserve the vital organs. Okay, and it does that by going to energy conservation mode. Okay, so this the definition of shock is a condition involving insufficient return of blood to the heart. Okay, it could be hypovolemic shock, which is when somebody has very low volume. Okay, or septic shock, when somebody has a severe blood infection where all the toxins of that bacteria go to all your organs, and those organs themselves start to shut down. So that's another type of shock. Regardless of the cause, okay, the heart or the tissue does not receive enough oxygen, and the person starts to show symptoms of paleness. So the person becomes very pale, cold, and clammy, become very, very sticky. All right. A rapid pulse might also be noted. Okay. But I think the most obvious signs are paleness, cold and clammy skin. Clammy is like sticky. Okay. It's because their body has shifted the circulation from the arms, from the limbs to the center of the body. Okay. So in an effort to preserve, right, the vital organs, the body automatically takes away the circulation from the limbs. Okay, from the arms and the legs. So the body starts to sweat. Okay, increase shallow breathing rate and staring eyes, because this is a very serious situation. If you ever see someone in shock, you should probably start preparing for the worst. Okay, in case they stop breathing, then you have to provide CPR. So what do you do when someone is in shock? Please make sure that you keep an airway open. If they're still breathing, just monitor them. Of course, you activate 911, but make sure that their airway is always open. Call for help by activating 911. Keep them lying down with a head lower than the rest of the body. All right. Now, if you have a chair, you can elevate the legs. If they're in a hospital bed, you elevate the legs. All right. You're trying to return circulation back to the center of the body to preserve the vital organs. Okay. If they're bleeding, obviously that has to be controlled using the hemorrhage, okay, management techniques, or whatever other cause of shock. Keep the patient warm, okay? Keep them warm until help arrives. If they still have a pulse and they're still breathing, just keep them warm. That's the best thing that you can do for them, right? By keeping them warm, you're keeping the circulation to this center part of the body, and you preserve, okay, their circulation and their vital organs, which are the most important. You will see probably questions about this on the national exam, okay, about first aid. CPR and emergency cardiovascular care. All right, so we take this training. If you haven't done already, please let me know so that you can schedule a class. The CPR training, BLS for healthcare providers, basic life support for healthcare providers. This is the one that we use. We do not use the Red Cross. Okay, we do not use any other training aside that is not American Healthcare Association guidelines. All right, and then we go into this, into depth about the compressions, the respirations, the AED, and all that. So please schedule a class so that you can make sure are familiar with the most recent guidelines. Right, the compression rate for CPR is 100 to 120 beats per minute. Okay, on adults we usually compress 2 inches. On infants, which is 0 to 1, we compress about 1.5 inches. Okay, it's like I said, it's just a class in itself, so we go into that into depth in the CPR class. All right, so let's continue. All right, the last section of this book talks about personal wellness, and we cannot emphasize this, enough. You have to be able to take care of yourself. Nobody's going to do it for you, all right? It's not just about what you eat. It requires like a holistic approach, like all of you, not just your physical body, all right, but all of you. You have to be mentally healthy, right? Mentally stable so that you can perform at your best and work, okay? You need to be uh, have a good relationship, okay, at home. You should be socially, spiritually, okay, and all your economic needs met. If you don't have all these things, in order, that creates a little bit instability in your performance. So make sure that you are addressing every part of your life, okay, not just your physical needs, but every emotional needs, psychosocial needs, and so on. Keep up with yourself, okay. Of course, hygiene is very important, not just for your appearance, but for your well-being. All right, what we how we look is what people judge us. Okay, so we show up at work and we don't look very well groomed, we don't make a good impression. Remember, we have to look professional. Proper nutrition is obviously essential. It's a basic need. We need food and water. We need to be well nourished to be able to function. Otherwise, we're going to be fatigued and tired and not perform at our best. Rest. We're not machines. We have to rest. We have to get our sleep. At least 6 to 8 hours of sleep. Lack of rest and sleep can lead to fatigue and other medical problems. You will be stressed out. Okay. Do a little bit of exercise whenever possible, so you can have a healthier life and live a lot longer. Focus on strength, flexibility, and endurance. Okay. Like brisk walking, jogging, things like that. You don't have to be a gym rat or anything like that, but do take care of yourself. Most importantly, take care of your back. We talked about body mechanics in our CNE course. The ABCs of body mechanics: good alignment, a base of support, and center of gravity. If you don't practice those items all the time, every single time you are going to perform a transfer or a lift or something like that, you have increased your risk of getting an injury, especially back injury. And let me tell you, back injuries are with you for the rest of your life. So you have to make sure that you take care of your own back because nobody else will. Okay. Healthcare workers are at risk for back injuries because of activities like lifting and moving patients. So it's very important that you take care of yourself. All right. If you cannot move someone by yourself, please ask for help. Okay. The stressful environment that we work in can be something very demanding. So it, you have to learn to manage your stress. Okay. How do you manage stress? Number one, identify the stressors. What is causing you to be stressed? Is it your home life? Is it work? Is it an individual? All right. Only take care of the things that you can control. Right. You cannot control people. Right. So, but you can control your environment. So if you're working in a facility, in a setting where you're not entirely happy, you don't feel, you're not happy to go to work, and etc. Please make sure you do something about it, because whatever you feel, sometimes we pass it on to our patients. Okay, and that's the last thing we want to do. We don't want to make them feel uncomfortable, or we don't want to show our face like we're stressed out. People can read us. Okay, people can read us. Our body language sometimes is a lot more than what we're speaking. So make sure that your stress management is there. Okay, that you make sure that you give it a good presentation, look professional all the time. Okay, all right. So we're pretty much done with this section, chapter 3. The main focus, I think, the main takeaway you should get is infection control. Number one, infection control is one of the most important parts of this section for exam purposes. Bloodborne pathogens, all right. Wearing your PPE is very, very important. Okay. Some of those first aid measures will be on the national exam. What do you do when somebody's bleeding? What do you do when somebody gets electrocuted? Okay. How do you control a fire? Using race, using pass. Um, what else is going to be covered in the exam? I think there's other questions related to pretty much first aid. Okay. How do you help someone that has stopped breathing or doesn't have a pulse? CPR. All right, remember that. So again, thank you for your time. Please make sure you go back and view this presentation again. If you have to listen to it, there is just audio if you want to do that. So please let me know if you have any questions or concerns. For right now, we're done with this presentation. If you have any questions, let me know.
Mm-hmm. Crazy, right? Is the important part. Damn it. Go back. Infection control. Yeah, that.
Hey everyone, Ryan here. Welcome back to our patient management series. In this video, we're going to talk about infection control, which is a relatively straightforward topic, but it has some really good high yield information that can net you at least a few questions on the board exam. So we're going to start with a couple of important times to know. So these are some nice numbers to commit to memory if you have any room for it. So washing your hands should
What was that? Did I just get hacked?
apparently take at least 15 seconds minimum. And flushing ultrasonic scalars, so flushing out the water lines after each patient to ensure a clean water supply for the next patient, should take at least 20 to 30 seconds. So, for what they're worth, these are numbers that board examiners have historically stuck to. Next, some routes of transmission. This is some microbiology territory, and these are 4 classic routes of transmission to have a relative familiarity with, because we'll be talking about specific diseases that are important to know in the dental clinic setting, and so routes of transmission will come up there. So our first one is direct contact. So this is direct contact with infected body fluids of another person.
I see.
Indirect contact is via a fomite. This is some inanimate object like an instrument, clothing, furniture, you name it, it can be a fomite. So something that someone else has touched with some infectious body fluids and then it's transmitted to you via that inanimate object. The next one is droplets or aerosols. So these diseases are spread via infected air. And specifically, you might hear the term droplet nuclei. That's referring to these droplets that are carrying some sort of disease. And lastly, we have parenteral contact. This is via a needle stick injury. So this could be if the needle pokes you in the blood vessel, it could be intravascular, it could be just intramuscular, or it could just be under the skin, subcutaneous, perforated through the skin layer. So these are 4 classic routes of transmission to have, again, a good familiarity with. So now let's talk about a specific group of diseases, and these are hepatitis. It's a group of diseases that cause inflammation of the liver. So Hep A and Hep E are both transmitted fecal orally. So this is kind of gross, but that means they're transmitted primarily through oral contact with feces. So this typically involves like contaminated food or water, or you could think of kids running around in their diapers at daycare. They can easily be spreading stuff like this, hepatitis A and E, if they're infected and practicing poor hygiene. Now, Hep B and C are transmitted via contaminated blood. So this is percutaneous contact with contaminated blood. Can also be other body fluids like semen. And Hep D is the one on its own. This one's caused by direct contact, also caught with percutaneous or mucosal contact with some infectious blood or other body fluids, but it's usually acquired either as a co-infection or superinfection in people already infected with Hep B. So there are 3 memory tricks I have to help you remember these 5 routes of transmission. So the first one is pretty easy. Hep D is transmitted via direct contact. So just remember D and D. A and E are both fecal oral. And lo and behold, the 2 vowels in the word fecal are E and A. So that helps you remember that. And lastly, contaminated blood. This phrase begins with C and B. And lo and behold, those are the 2 hepatitis that are transmitted via contaminated blood. So hopefully those 3 memory tricks can help you to clearly remember hepatitis for the rest of your life. All right, so now let's talk about specific ones with relatable routes of transmission in the dental setting. This is being contaminated blood. So Hep B has a 30% risk of transmission after percutaneous injury through the skin. So this could be you poke yourself with a needle or a sharp burr by mistake. And of course, it has to have the infected body fluid on it. So DNA virus, this is caused by a DNA virus, and it specifically has this thing called a Dane particle. So the Dane particle is a spherical particle found in the serum in hepatitis B, and it's the virion of this causative double-stranded DNA. So the vaccine for Hep B is available, and I'll cover this again a little bit later, but the Hep B vaccine must be offered and available to all dental employees. So that's really important because 30% risk is relatively fairly high. So everyone should have a vaccine to be covered. Now, post-exposure prophylaxis, this means a cure after you have said disease, in this case Hep B, includes the vaccine and possibly an immunoglobulin in addition to that. All right, next, Hep C. This is the other one that is caused or transmitted, I should say, via contaminated blood. So this one is a bit lower risk at 1.8%, again, after percutaneous injury, needle stick, etc. This one's caused by an RNA virus instead of a DNA virus. And this one, no vaccine is currently available, although they are working on one. And post-exposure prophylaxis has recently become available, but the course of medications is incredibly expensive. So again, this is fairly recent. When I was studying for the board exam, this was not a thing. Hep C was not curable. Now it is, but it's extremely expensive. So if you have acute hepatitis C, that's most likely going to go away on its own. But chronic hepatitis C that lingers around can cause some serious cirrhosis, which is liver scarring, and these are the cases where medication may be considered. All right, so next we have HIV. So we're no longer talking about the hepatitis family of viruses. Now we're talking about HIV, which is another RNA virus. This one has actually a very low risk of transmission, only 0.3% after percutaneous injury. This one's diagnosed when antibodies to HIV are detected in the blood by this thing called an ELISA test. So that's a nice high-yield thing to remember, HIV and ELISA. No vaccine is available for it, and post-exposure prophylaxis is a lengthy course of antivirals. Again, not cheap. All right, next we have TB, or tuberculosis, and this one is really important to know for the dental clinic because a patient or an employee if they've traveled outside the US in certain countries, TB can be transmitted relatively easily if you have someone with an active TB infection. So this one's transmitted via infected droplet nuclei. So this is different from the other ones. Everything else we've talked about in detail has been percutaneous injury with contaminated body fluids. This one is caught via infected air. So TB is diagnosed by, and fortunately there are a lot of different ways we have to diagnose TB.
Yeah, we do. Symptoms
include coughing up blood, night sweats, and very high fever, and this is pretty specific for tuberculosis. Now, I actually had a case of necrotizing pneumonia, which is a very rare form of pneumonia, and I had a lot of the same symptoms, coughing up blood, night sweats, and it was not fun, but don't worry, I'm okay. And that was a little while ago. But for any other disease, the symptoms I'm describing are very specific for tuberculosis. Now, you can also diagnose this via a sputum culture. So I had to do this to rule out tuberculosis. And so you cough up into a test tube and they test for the presence or absence of the mycobacterium found in TB. Chest x-ray is another good thing to do. This is, you have some cavity in your lung that's specific for tuberculosis, and you can do a blood test or more commonly a tuberculin skin test. So a patient with active TB should not be seen for elective dental care, Now, if it's an emergency, while in the dental clinic, everyone should be wearing a protective mask, which makes sense because we know it's transferred via droplet nuclei
Let's do this the other way
in
now.
the air. And so healthcare workers should have this tuberculin skin test.
All right, before we actually start getting into the steps of collecting blood, I want to talk about assembling your needle here. Now, this is important because I want you to understand that there's for me, a right way and a wrong way to assemble a needle safely. Now, most people like to assemble a needle their own way, and I've seen many people, including my students, stick themselves because they had assembled the needle the wrong way. Now, I'm going to talk about this in a minute. Because I want to make something clear. When I go into a patient's room and after I do the patient ID and I make sure that the patient is who he is, and if you go back to my lecture videos, I talk about the steps, the 3 Ps of asking a patient, which is important. So if you're not familiar with that, please go back and watch that. I like to assess the arm, both arms. I like to tie the tourniquet on with my gloves, like you saw earlier, and then I like to palpate and look for a vein on either arm. And once I find a vein that I'm comfortable with, then I release my tourniquet and I proceed to get my equipment and assemble, letting the arm rest. But I do like to assess both arms and even the back of the hands in case I can't find a vein on the arm, specifically in the antecubital fossa area. I look for the median cubital, I look for the cephalic on the outer part, and of course the basilic on the inner part of the arm. Basilic is always last. I'd rather do the back of the hand, and I explain that in my other videos on the order of veins. So again, I always assess both arms, including the back of the hands, to feel comfortable, and then as the patient is resting on the site that I'm going to be drawing on, I get my needle and my equipment, which I'll show you in a next video. Now, this is important because the green side is the part where the needle is. Now, every needle has the gauge, and it tells you on there, if you're not sure, it'll tell you on the sticker here if it's a 21 gauge or a 22 gauge straight needle. Typically, you're going to find only 21 and 22s in labs and hospitals, but the most preferred and the preferred needle to use on any venipuncture is a 21 gauge needle. So if you see that on an exam, the most preferred needle, it's 21 gauge always. This plastic part here covers the rubber sleeve, which I'm going to show you, that actually covers another needle. And you got to be very careful because you can't stick yourself with this needle. Yeah, what I'd like to do is grab my 2 fingers and my finger and my thumb right on this pink plastic sheet here, which is a protective sheet. Grab it right there at that midpoint to my finger and my thumb. Hold it. Twist the white off just like this. Pull it away. I don't like to do this because I've seen people come back and stick themselves. I like to twist and pull away. Now again, there is a needle in here. If I pull back on this rubber sleeve, which do not do or recommend this, but I'm going to show you, there is a needle in there that collects the blood into the tube, and this rubber protective sheet covers the needle and also helps prevent carryovers into the other tube. So again, protective sheet, this protects the needle and also prevents carryovers. I take my plastic hub, my vacutainer holder, and I bring them together. I don't like to do this, and I'm going to show you because, again, you can stick yourself like this. I bring them together carefully, and I attach the hub on there, make it nice secure, hold up. I bring the plastic sheet down. I make sure that this is still secure, and now my needle is ready to go. Let's talk about palpating the site, vein locating. Let's talk about getting the site ready. Of course, we're talking about anchoring the vein. We just talked about assembling the needle, the order of draw, the tubes, and of course, let's get into the whole process of how we do this. Now, a couple things you understand. There is always a right and wrong way to draw blood, specifically the order of draw, the order of veins. There is a CLSI standard, that's the Clinical Laboratory Standard Institute. If you're not familiar with that, you need to go back and watch some of my videos on the agencies and different procedures that they recommend. Now, we already talked about the tourniquet. Now, what I like to do again when I assemble my needle is exactly how I showed you.
You guys don't know how to do a tourniquet.
So,
You're at the wrong
what we got to
video.
talk about now
That's the other
is
video.
locating our veins. So, once I've gone and I've ID'd the patient, and I told you before, I tie the tourniquet, I want to locate a vein and make sure which one is the best vein possible.
Above the arm.
Then, of course, I want to make
Above the
sure
elbow.
that the patient is comfortable. I'm not rolling my tourniquet here, and I've got good veins. I want to take my finger here. Now, this might be a challenge with the gloves, but you have to learn to feel a vein with your gloves on. I don't like palpating an arm without gloves because, again, I don't know if the patient has anything on the skin. I don't want to, catch anything or transmit anything to myself without the gloves. So you're going to have to learn to master this. Now, I like to palpate. What I like to do is I like to push down with my index finger here. Some people like to use the middle finger, which is fine. I don't use the thumb. The thumb, because of the artery, the radial artery, you can get a pulse on your thumb if you're doing this, and you might think you're hitting the brachial artery when you're not. So I want to make sure that I don't use a thumb. My index finger or middle finger is fine, but here I like to palpate, push around, push down, feel for sponginess. I want to feel the depth of the vein. I want to feel the width of the vein to see how wide it is, if it's good for my needle, 21 gauge. I want to feel how deep it is because, again, we have to look at 15 to 30 degrees only.
Smaller.
We can't go anything above 30 degrees. So it's typically up to 30 degrees, or I like to say 15 to 30. So I like to palpate.
The other way.
Feel for my vein, different directions, where the vein is going, how deep it is. And once I locate a vein, that's when I will get my equipment ready. So I found a vein I'm good for, whether it's the median cubital, which is dead center. And again, look at my order of vein videos. The cephalic, that could run median cephalic, or if cephalic runs straight, or it could be median cephalic. Or, of course, the basilic. The basilic can be median basilic, or it can be basilic running straight down. This one I do want to avoid at all costs because of the brachial artery. And again, my order of vein video does explain this in detail. So I find my vein, either median cubital or median cephalic, then I'm ready to go. I release my tourniquet, pulling towards myself, and then I go into assembling my equipment like I just showed you. So I take my needle, 21 gauge, pull it here,
you could do a needle and a vein.
Attach my needle, bring this down,
a needle is just
make sure it's secure,
tube inside
and I place it down. Now you're
tube.
going to notice
And a vein is just
that all my equipment is on my right side because I'm right-handed. If I'm left-handed, I want all my equipment over on my left side. The reason being is I don't want to be drawing with my right hand and have to, or if I'm left-handed or right-handed, depending, I don't want to be drawing here and having to reach over. So if I'm left-handed, then here I can take my equipment. So in this case, I'm right-handed. I bring my stuff over here,
everything on my left side,
just like this. And now I'm ready to go. Now this is, of course,
my dominant hand is the one that's actually feeling like the
so that when I'm in, I can easily get my equipment. I don't have to reach over. So again, depending on which side, if you're right-handed or left-handed, you want to make sure your equipment is on the side that you're going to be reaching for to grabbing your tubes, not on the side that you have the needle. I don't want to be reaching over because that can cause the needle to move and discomfort for the patient. Okay, so everything here is ready to go. Now let's talk about the alcohol. Palpating the site. So here we go. I'm going to leave this on just so you can see the whole steps. Of course, it's going to be longer than 1 minute, but I'm basically going to be showing you so that when we do it, you'll see it will not go over 1 minute. So again, I've located my vein 3 to 4 inches above the site. Located my vein. I'm going to tear open my alcohol. Now, some people like to take this and just start doing this. And all you're doing is just circling over the site. That's not cleaning the site. All you're doing is taking whatever is on the arm and on the alcohol pad collected and just going in a circle and just redistributing whatever's on here. That's not cleaning the site. What CLSI standard is that when you fold your alcohol pad, usually in quarters, start from the center of where you're going to draw from. Let's say I'm going to just say the median cubital is right here. I'm going to start from here and work my way out in symmetric circles, working outward, just like this. So now I have not rubbed the site over. I've worked my way center out, and then I'm good, and I let it dry. Now, some textbooks will tell you do not blow, which you don't. You never blow on the site because some alcohol pads are wetter than others.
You know that.
Some textbooks will say don't even wave your hand. I don't mind this. This is not going to stir up air current. If I'm breathing and talking, that can stir up air current. If you're blowing and you're bringing your mouth to the site and putting whatever's in your mouth on the patient. Now, again, you cannot touch the site. You cannot repalpate. Once you alcohol the site, it's off limits, so you better know where you're going. This is where your skills kick in. And as many times as you do a blood draw, that's going to tell you where it's at. You should automatically be focused on where this is. And I'll show you another technique afterward about marking the site with your cap here before you alcohol. Now, once you're ready, to uncap the needle, and you're ready to go here, your 2 fingers and a thumb. Basically, you're going to turn your hand face down, palms down, as usually I like to say, and I like to grip the cap of the needle, and I like to pull away. Try not to twist and pull, because if you twist and pull, you could actually take the needle and unscrew it. So palms down, grab the pink protective sheet, and pull away. This is the best way to retract without doing this. Do not pull away this way, away, and do not pull it towards you. Simply aside and away. So let me show you one more time here.
It's like
use the scoop method.
The sword
right here, 2 fingers and a thumb, palms down, grip the cap, pull away, set it down, and now you're ready to go and you're ready to draw. This is very important here, because if you look at my needle, the bevel, which is the shaved part of the needle, must be always facing up. And that way the lumen in the needle is facing up. If it's not, if the needle is sideways or upside down, I won't get blood half the time. The needle or the bevel can be against the vein of the wall, blocking the lumen.
Like a straw.
I could be upside down, again, blocking the lumen. I could be halfway in. I've got to know that the bevel is always up. I always hold this 2 fingers and a thumb. Everybody holds it differently. For me, the most comfortable way is 2 fingers and a thumb. I'm leaving enough room here in the back for my tubes so I can get my tubes in and out, which I'll show you. So they're free to use the little phalange grip here to push in. So I like to use, of course, 2 fingers and a thumb, leaving enough room here, and I feel more comfortable. So that when I'm ready to go in, I have a perfect set spot for my fingers. Some people hold it differently. Some people hold it like this. It's a little harder for me to get tubes in here, depending on your preference, but I prefer 2 fingers and a thumb closer to the front of the vacuum holder. And once I'm ready, I'm going to anchor the site or retract the skin. I don't want to retract up here close to the site where my needle and my hub have to go over my thumb. That will increase my angle of insertion, and that can also cause me to miss the vein or go too deep, and can cause harm to the patient as well. I want to retract towards the forearm or below towards the wrist, pull back so I have enough free area right here to go ahead and draw with no problems. So again, do not retract up here where my thumb is. If I'm doing this, then I'm too close. Retract below so I have a good angle, 15 to 30 degrees. And once I go in, I'm looking for the bevel to go in, which is right here. Now, typically this part should be lined up with the bevel, so you know it's up. So if the pink's up, the bevel's up. Retract. Make sure the bevel goes all the way in, and then hold. Now, once I do this, I'm going to get my tubes. Now, if you look at the order of draw, of course, you can go light blue, red, of course, SST, green, and lavender. Standard order of draw. I'll show you where the red top can precede the blue on a butterfly draw to get the air out of the tube on another video. But again, I take my light blue, I put it in label up. And if you see, my 2 fingers are resting. Let me explain this real quick. My 2 fingers are resting on the arm. It's not floating like this where my needle is moving. If the patient moves, it can mess up my needle. Once I go in, 2 fingers and a thumb, retract, push in. My 2 fingers rest on the forearm. I should have some pressure, not too much pressure, but enough where my arm will move with the patient. If he moves, my hand moves and doesn't just cause this type of effect. Okay, so again, retract, bevel up, go in, hold, Light blue tube, label is up. The label is, the label is down so I can see blood flow. If the label is facing up, it's harder for me to see if there's any blood, because sometimes the blood will start to creep in and it's not flowing in good, not flowing in enough, or the strength of the vacuum is not pulling it enough, because maybe I'm not in the vein far enough. So basically I'm looking for, and I can't see if the label's up, so I turn it, and so when I push in with my 2 fingers and my thumb behind the tube, 2 fingers on these little phalange grips, push in, and I should get blood flow. I can see it squirting in. If it's not, then the only thing I need to do, the only adjustment I can make to this needle, which is again on my other videos, is either going a little bit deeper, or if I think I went too far, pulling a little bit back. I cannot, and this is against CLSI standards and against patient care, and this can cause damage, is redirect my needle. I can't fish, what they call fishing. Fishing can cause damage to the inside of the arm. That needle is like a miniature scalpel. As I'm moving it, it can cut the tissue, it can lacerate the vein. I could even hit an artery and lacerate an artery if I'm not careful. You should never fish in a patient's arm. I could only go a little deeper or pull back. If I get no blood flow on either pushing or pulling back, or even retracting a little bit to help stabilize the vein, then I've missed the vein altogether and I need to start over. Once I get blood flow, then what I do is I'm going to remove my tube and get another tube. Again, no fishing. These phalanges is going to help you take the tube out. I don't want you, 2 things. I don't want you to put the tube in by pushing it in, because that can push the needle in the arm. Don't push it in, and don't pull it out. Once the tube is in, what I'm going to do is take my index finger here, rest it on the inside right here of the phalange. My middle and my thumb is going to grip the tube. I'm going to twist and push away with my finger to release the tube. Invert the tube at least 3 to 5 times, set it down, grab your next tube, slide it in, label down, 2 fingers and a thumb on the phalange here, pop it, let the blood flow.
Pop it, lock
my
it.
index finger rests right here, middle and thumb twist and push away once it's full and it's stopped, and this will help release it. Invert, bring it down. SST tube next, then my green and lavender. So again, label down, pop, let it flow, index finger right here, middle and thumb grip the tube, twist and push away, invert, set down. Once I'm done filling up all my tubes, and I'm not the 1 minute mark,
You guys can check me out.
then I'm going to release my tourniquet. Now, some people like to release it while they're doing a blood draw. So if my last tube is my lavender and I'm doing this and it's getting blood flow, some people like to release the tube prematurely while it's filling up. The problem I have with that is that if this tourniquet is helping venous restriction and it's helping me get blood in,
the vacuum might not work.
The minute I release that tourniquet, I could cause the blood flow to stop. It is a possibility.
Yep.
If you're in the vein well and it's getting good blood flow, it might not happen. But if I'm in and this is actually doing its job and it's actually helping, squeeze the vein a little bit to help restriction to push the tube with the vacuum in it and getting the blood in, me releasing it before it fills up could cause the blood to stop, and then I have to restick the patient, which I never want to do. So what I want to do is first pull my tube out, invert, put it down, release my tourniquet the way I showed you, pull towards you, and then get my 2x2 gauze right here. What I like to do, I never like to put my 2x2 over the needle, okay? I keep it on the side. The reason being is, again, safety. If I put my hand over the needle and just place it here, when I come out, if the patient should jerk or I get bumped, where is the needle? It's lined up right here in front of my hand and finger. And if this needle can go right through the gauze and stick me with a contaminated needle with blood on it. So I don't want to do that. So once I'm in, do not bring your hand over. It is dangerous. I've seen people get stuck that way. I come on the side right here next to the arm. I bring my needle out, and as I move away, I cover and place my 2 fingers over the site, immediately capping my needle. Once I cap it, then I dispose of my needle, and I keep pressure here, or I have the patient put pressure over here. Now, if you look at my post-care instructions video, where I talk about what I do next, you should have watched that video on post-care instruction. I leave pressure on here with the patient either putting his own thumb, gripping it right on his arm, or he can put his own 2 fingers on there. I come back 3 to 5 minutes, checking, making sure it stopped bleeding. If it isn't stopped bleeding, if it's still bleeding, I go 3 to 5 minutes. If you watch my 3 Ps, you'll know why they could still be bleeding. So once I check 3 to 5 minutes, it's good, no blood flow, it's not bleeding, plus over, I use gauze. I do not use tape, and I do not use Band-Aids. Again, CLSI does not recommend tape or Band-Aids anymore because tape and Band-Aids can rip the skin and cause skin irritation and, again, discomfort for the patient. We use Coban, self-adhesive Coban. I wrap the arm in Coban, not tape and not Band-Aids. That prevents any irritation or tears on people who have sensitive skin. The Coban is self-adhesive. It wraps around. I keep it on there. I let the patient know to not lift anything heavy for at least an hour. I tell them to keep the bandage on for at least 15 minutes. Again, this is post-care instructions. And I tell them that if you lift anything heavy within the hour, you can cause a bruising because, again, the weight on the arm that they've just punctured can cause bleeding on the inside with like pressure. So I tell them no lifting for 1 hour. Keep the bandage on for at least 15 minutes. All right. And of course, I assess the patient to make sure that they're either able to get up and walk and they're fine. Remember that.
That's it. The butterfly draw. Ooh, we could learn that next, or we could learn legal.
They're either
to be more and more of
I
a
was
big.
watching that yesterday. Hey, it's not what we want. We want YouTube. Why is YouTube broken? Oh, hey, there I am. My own video, my own recommendation. There it is. Been looking at this. Did I do anything embarrassing?
Skin test at least once per year. This is a high yield fact. I've definitely seen it come up on the board exam. Get it at least once per year. Now, the skin test is the standard method of determining whether a person is infected with Mycobacterium tuberculosis, the infective agent. So they inject a tiny amount of tuberculin purified protein derivative, or PPD, into your forearm, and then they look at your arm in 48 to 72 hours and see if it's indurated, which means it's hard and raised, and or red. All right, so some personal protective equipment, or PPE. I'll go over this relatively quickly. We have, of course, our gloves, latex, which is going out of style because of latex allergy. Yep. So there's also nitrile gloves and other forms. So whenever touching something that's contaminated with body fluids, you should be wearing gloves. And you, of course, should be switching out gloves whenever you're switching patients or you're going to wash your hands or you're touching a new surface that's contaminated by some other source, etc. So you should be changing gloves relatively frequently. Utility gloves are a lot thicker than your normal gloves, and they shouldn't be used during surgical procedures because they instead should be used to wash and rinse dirty instruments prior to sterilization. Masks should be swapped out per patient. Protective glasses, or if you're working as a dentist, you may be using loupes that are also serving the purpose of protecting your eyes. This is protecting from spatter, splash, and projectiles. And a good thing to know for the board exam, the personnel most at risk for eye injury is the dentist. And gowns should be switched out per day unless you have some gross debris, blood spatter on it, etc. then they should be swapped out more frequently. All right, the Occupational Safety and Health Administration, or OSHA. You've probably heard of this organization. So this
OSHA,
concerns everything inside the office. So they're responsible for determining regulations for everything that goes on inside your dental office. OSHA protects healthcare professionals from occupational hazards, which is in the name of the organization. And as part of OSHA, what I mentioned before, all dental workers must be offered a free hepatitis B vaccine. So that's really important, that should be paid for by the employer, that all dental workers should be getting this vaccine. Any dental worker who experiences a needle stick injury must have an exposure incident report written and then must be immediately given a paid for, again, by the employer, a confidential medical evaluation and a follow-up. Clothing worn at work, so if you have reusable gowns, they cannot be washed at home, which is an interesting regulation, but it does make sense. Everything should be washed at the office where it's being used. And lastly, the Hazard Communication Standard, or HAZCOM for short. This was created by OSHA to make sure employees know about potentially hazardous materials like amalgam and silver diamine fluoride, for instance. And we'll talk more about safety data sheets in the next video on material and equipment safety. So if OSHA is everything inside the office, the Environmental Protection Agency, or EPA, concerns everything outside the office. So some important things to know for this and their regulations: established maximum exposure levels for mercury vapor are at 0.1 micrograms per kilogram body weight, yada yada. And then it also regulates transportation of dental waste from dental offices. So dental waste out of the office, other potentially hazardous materials into the office. The EPA regulates the transportation of that. All right, now let's talk about some specific methods of sterilization. So sterilization, an incredibly important definition, involves the destruction of all life forms, including bacteria, viruses, and spores. So that's really important that it includes also spores, because other methods that we'll talk about will not take care of these spores. So glutaraldehyde is our first method of sterilization, and this involves making a bath of cold solution used for heat-sensitive items. So this could be like rubber ligature ties and orthodontics, or plastic impression trays, things that can't withstand very high temperatures. But this does require a long time of said instruments sitting in this bath of glutaraldehyde solution. Next, we have pressure sterilization, also known as the autoclave. And so the autoclave involves a very high temperature, 121 degrees Celsius, at 15 psi, pretty decent amount of pressure, for 20 minutes. And this is this setting is governed by the FDA. So it's a pretty standard 121 at 15 psi for 20 minutes. And it is worth committing to memory for the board exam. I would definitely encourage you to do that, because some of this information can absolutely appear on there. So what the autoclave essentially does, it's using some high temperature, moist heat and also pressure to destroy bacteria by denaturing their proteins. So denaturation of proteins is the primary mechanism that the autoclave is taking care of bacteria. Now, biologic monitors, these are test strips containing spores to test the effectiveness of the autoclave. And this should be done weekly to make sure that your autoclave is functioning properly. So again, you put test strips in, They're color indicated or some other indicator, and they'll have spores on them, and it'll essentially confirm for you that your autoclave is doing its job. There are also process indicators, which are similar. They're test strips that change color if certain physical conditions are reached, specifically the temperature and the pressure. All right, we have two more methods of sterilization. We have dry heat sterilization, which involves heating instruments for at 160 degrees Celsius, so even hotter than the autoclave, for 60 minutes, so a bit longer as well. Now, only glass or metal objects can be sterilized with this method due to the incredibly high temperatures. Now, I do like this setting because it's relatively easy to remember. 160 for 60 minutes. Some people will say 160 degrees Celsius for an hour. You can remember that as well. I just like that the 60 and 60 line up with each other. So dry heat destroys bacteria by coagulation of proteins. So where the autoclave destroyed bacteria via denaturation, this one destroys them by coagulation. So for what that's worth, it is a high yield fact for the board exam. This method also, interestingly, has the best preservation of cutting edges. So if you have important instruments, scalers, ligature cutters, whatever you need with really, you want to preserve sharp edges, that's the way to clean them. Lastly, we have ethylene oxide. Ethylene oxide gas uses relatively low temperatures, especially compared to the previous two methods, and can penetrate materials to sterilize pre-packaged items. The best example I could come up with are PSP plates used in x-rays. So PSP plates have these thin, like plastic packages when they're after they're used, and you put them in new packages. And so ETO is the typical go-to sterilization method for those. It does require a lengthy aeration process, though. All right, so that was sterilization. Now we have disinfection, which is another category of cleaning things. These disinfectants are used on inanimate objects only, so we're still talking about instruments, etc. We're not talking about using this on yourself. And here we go, spores are not destroyed in this process. So if sterilization is your top tier cleaning, disinfection is one step down. But the good news with disinfection is Mycobacterium tuberculosis is taken care of. Now that is a very difficult microbe to kill. So your benchmark for proper disinfection is if you can take out that microorganism. Here's another important number to remember when we were talking about times before. Letting disinfectant sit for 10 minutes is ideal, and then wipe afterwards. And lastly, this is our third tier of cleaning, is antisepsis. So antiseptics are used on living tissue to reduce the bacterial load. And these are, of course, not typically as potent as the other two methods. So some examples, we have alcohol, which is the most commonly used antiseptic, and it involves denaturation of proteins, which we saw before as part of the autoclave actually kills bacteria in the same method. Chlorhexidine is another antiseptic used, and this one has substantivity, which means it has a continuous long-lasting effect, so that is a nice antiseptic to use. Detergents help loosen and remove microbes from the surface with rinsing. So detergents, think like when you're cleaning, washing dishes, and you can use detergents to help loosen the grease and other things on your dishes. Similarly, an antiseptic detergent works. And lastly, we have quaternary ammonium compounds, or quats for short. These are probably the most potent on the list. They disrupt cell membranes, and they're lethal to a wide variety of organisms, except, unfortunately, endospores, TB.
Yep, this one.
Hey everyone, Ryan here, and welcome back to our patient management series. In this video, we're going to talk about materials and equipment safety, which is intimately connected to our last video on infection control. So we're going to start by talking about mercury. Now, of course, amalgam is safe to use, but it's certainly not used as much as it once was due to increasing aesthetic concerns. But because mercury is a component of amalgam, it's important to be at least familiar with its material safety. So when dealing with mercury, inhalation is the biggest risk. If a spill does occur in the dental clinic, you use a special vacuum system and then apply a sulfur powder on the floor where the spill occurred. And the powder absorbs the elemental mercury, which makes it easier and safer to handle. Now, significant mercury exposure can lead to acute mercury toxicity, which includes the following symptoms, which can be brought up on the board exam. So these include muscle weakness or hypotonia, loss of hair, alopecia, weight loss and GI disorders, and this general feeling of tiredness and exhaustion. So there are various forms of airborne particles that occur and appear in the dental setting. Two definitions that I'd be familiar with are splatter and aerosols. Now, splatter or spatter, they're both synonymous terms, involve visible drops of liquid. These are greater than or equal to 50 microns. They fall within 3 feet of the patient's mouth. So this is about 1 meter for all of you metric people out there, and this is known as the splatter area or splatter zone, where 1 meter diameter from the patient's mouth is where the splatter can move to. And splatter, because it's visible liquid of a certain diameter, it can carry blood-borne pathogens like Hep B, Hep C, and HIV that we talked about in the last video. Now, aerosols are invisible particles. These are less than 50 microns. And this also includes those droplet nuclei, which are less than 5 microns. So aerosols, because of their size, can remain floating in the air for hours, but they're only able to carry respiratory infections. So this would be like tuberculosis or TB. Again, something we talked about in the last video. Now, the exact diameter measurements will be different depending on the source you look at, but I just like to keep it simple. So I like to just remember greater than 50, less than 50, but the more important thing is to remember that splatter are the visible particles, aerosol are the invisible particles. All right, noise control. This is something important to consider in the dental setting as well, because a lot of the instruments we use can be, well, fairly loud. And hearing loss develops slowly over time and can be caused by repeated exposures to greater than or equal to 90 decibel sounds. Now, there are other risk factors for hearing loss, but I'm talking about frequent chronic exposure to loud noises. And again, it's important to note for us because dentists are exposed to the noise of handpieces and ultrasonic scalers that can range from 60 to 100 decibels. So it's definitely something to think about. And if you're interested, this is a nice chart listing decibel level sounds from low to extremely, extremely loud. Water lines. So in the last video, I talked about the EPA, which is concerned with transport of materials in and out of the office. And in this case, water certainly fits the bill. So the Environmental Protection Agency requires less than or equal to 500 CFUs of heterotrophic bacteria per milliliter of water. So in microbiology, a CFU is a colony forming unit, and that's a unit used to estimate the number of viable bacteria or fungal cells in a sample of liquid. So the lower that number, essentially the safer and cleaner that water is. Now, it's not recommended to flush lines at the beginning of clinic because it essentially makes no difference. But like we talked about in the infection control video, remember to flush the ultrasonic for at least 20 to 30 seconds at the end of the day, or even better, between each patient. And you do this by connecting the scaler's water line to an air source, and then you run the scaler until all the water residue in the water line has been expelled. Anti-retraction valves, as used as part of the water system, are great because, as the name suggests, they prevent retraction of fluid from a patient into the handpiece, into the machinery, which could then be passed on to the next patient. So anti-retraction valves just helps keep the water nice and safe and nice and clean. All right, and lastly, we're going to spend some time talking about the material safety data sheet, now just called the safety data sheet, or SDS for short. So this is probably the most important fact in this whole video. The SDS is a manual made by the manufacturer. The manufacturer is responsible for writing these directions, not OSHA. OSHA and other hazard communication standards like it require employers to provide employees with immediate access to these SDSs for chemicals that they work with, so they know specific hazards for these chemicals, how to deal with spills, like we were talking about with mercury before, etc. So that's what these safety data sheets are talking about, but they're made and prepared by the manufacturer, and it's up to the employer to provide them to their employees. Okay, now that that's out of the way, let's talk about the actual components of a safety data sheet. So the SDS uses the National Fire Protection Association color and number system, and here in the bottom right-hand corner is a great key to help understand what it means. So a standard hazard label lists the health hazards in blue, the flammability of the chemical in red, its reactivity in yellow, and any other specific hazards here in white. And the numbers go from 0 to 4, from least to most dangerous. So in this example, we have a health hazard of 2, which is mildly hazardous, a flammability of 4, which is incredibly flammable, a reactivity of 1, which means it's fairly stable, but as it says here, unstable if heated. Of course, you don't have to remember all of these, just the general trend of what the numbers mean is just fine. And any specific hazards. In this case, this chemical happens to be an acid. So again, you don't have to remember what all these numbers means. By no means do you have to know that, but just remembering maybe if you have any extra room what each of these colors refers to. But again, most likely you're only going to get 1 or 2 questions on this section on the board exam anyway, and it's most likely going to be asking about the material safety data sheet being made by the manufacturer of the chemical. Now, I will give you bonus points if you know what this code is referring to and what chemical this is talking about. All right, so that's it for this video. Thank you so much for watching, everyone. If you're interested in supporting the channel, please check out my Patreon page. A huge thank you to Michael Raja, Reb Boyd, Leonilla Bunger, David Jaden, Yanet, Nicole, Isabel Caldis, Ali Benjdir, and all of my patrons for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the next video.
Goodbye, everybody. Hope you enjoy.